I am Jeannie. I'm going to be your student nurse today. I'm going to be taking care of your wound. And what is your name and date of birth? Okay, great. Using medical asepsis technique to assess the wound and to measure it. So first I want to look at it. I'm looking for any signs of redness, infection, purulent, and also exudate. Once the wound has been assessed, I am going to measure it. Can either use this round scale if it is symmetrical, and it looks to be about 7 centimeters in diameter. So at this point I am going to check the wound, and I'm looking for any type of tunneling or undermining. And I would note, I see some undermining at the 3 o'clock position and also the 6 o'clock position. If there is tunneling, I'm going to measure it with the end of the Q-tip swab and then measure it here, which looks like it is about 3/4 of an inch. The tunneling in that position would be noted at a 10 o'clock or 11 o'clock position. At this point, I am going to prepare a sterile field. And I will use a surgical technique for this. I've already started to prepare my sterile field. I'm going to put my sterile gloves on. Okay, so I'm going to split my field. I'm going to have my right side as my wet dressings, my left side as my dry dressings. So I'm going to start opening those, preparing, pulling away, making sure everything is still sterile. I will have my saline to at first with the saline, I need to open it and drain a little off the top. I will pour the saline on my dressings and make sure it doesn't cross into the dry barrier. Also going to get a 4x4 pad to cover the dressing after I'm done. So at this point, I want to use my clean hand to give to my dirty hand for cleaning. So pick it up. I'm gonna get it over here. I'm gonna clean the wound. And not touching the clean. Take another one. Giving my clean hand to my dirty hand, cleaning it out. And then I would take another wet dressing with the saline, pack that in, put a dry dressing on the top. And then I will use the tape, which I should have opened ahead of time. I'd be careful not to make the dressing packing too tight, or make sure the area of the skin is not compromised because of the tape. Okay. I would keep checking with the patient to make sure that they're not in any pain in any way. Okay. And I think that looks good. The last thing I'm going to do, I'm going to take my pen and I am going to write on the piece of tape my initials and the date and time of changing the dressing. Today's 3/25, 2020, and the time is 4:10 p.m. And that just alerts the other nurse or whomever that when they go to change, they'll know the exact time that the dressing was changed. And that's it.